Merci, Monsieur le Président.
Thank you, Mr. Chairman.
You on that, and maybe Dr. Butler first. I'm wondering if in your respective states you have considered, or maybe it's existing already, guidelines, like what should be safe guidelines of use of cannabis. And I'm thinking about it because we had some witnesses saying that it would be possible to come up with those guidelines, but we don't have them here in Canada, like we do have in alcohol, for example. You know, we have guidelines of what is safe to consume for women, for men, per day, per week. Does that even exist, or is it something that is considered in your states? And who should provide those guidelines to consumers?
Yes. Senator, thank you for that question. It's certainly a discussion that we have. I think the biggest challenge is the dearth of good scientific data to be able to guide that discussion. And that's where I sometimes find the discussion begins to try and pull data out of tobacco and alcohol, which, again, I would encourage you not to do that. We have focused primarily on guidelines that address the health concerns. So, for instance, when using edibles, we have put out statements that go low and start slow, or something like that. Don't keep eating waiting for the effect, that it's going to take 30 to 60 minutes for the effect to kick in. Also, messages regarding the effects on driving. And one of the real controversial areas is trying to figure out just, well, when is it safe to drive after using? And of course, that's also going to be influenced by whether you're smoking or vaping or using edibles. In the case of edibles, we have gone more of long, encouraging people not to drive within 8 to 10 hours after consuming.
Thank you.
And I'll add one other thing, is we've also encourage people not to use alcohol and cannabis together, particularly when it comes to driving under the influence, because the two substances seem to impair driving when used together more than either one used in equal amounts alone, because the brain compensatory mechanisms are each compromised by the other substance.
Thank you. Mr. Garza, I don't know if, did you?
Well, Senator, it's a great question. My counterpart from Colorado and I were last year before the National Institute on Drug Abuse in Washington, D.C., and we were sharing some of so much of this is about a lack of research and science around cannabis, because you're absolutely right. NIDA years ago suggested that depending upon the gender and the weight of a person, that you could consume amounts of alcohol, wine, or spirits. I asked them the same thing. We would like the ability to be able to tell the consumer that this is a level of consumption that would possibly be safe or not. They kind of looked at me like, I don't know what you're talking about. We don't have any way of knowing. And then consider the fact of how people consume this product, which is different, obviously, than alcohol. You have different ways. It's combusted, it's eaten, it's drunk, and how you would know what that is. But it's a great question, because we've asked it. We've asked NIDA and others to do research around what is a safe level of consumption for cannabis. But as far as I know, I'm not aware of anyone that's done that work. Much like the doctor from Alaska just stated, we're really doing a lot of messaging very identical to what they're doing around what is a safe, what you need to be aware with respect to edibles and other ways it's consumed.
Thank you.
Okay, let me slip in a question here, if I might. We've had some people in to talk about home cultivation. And home cultivation, according to my chart, in Washington is not permitted, but in Alaska they are allowed 6 plants per adult. So I'd like to hear briefly what led to the decision in those two different positions in the two states, and how's it going? How's it working or not working? So I'll start with Mr. Garza this time.
Well, it's interesting that we're the only state that has legalized adult use cannabis that doesn't allow for home grows. And really it came down, what did the initiative say? The initiative did not allow home grows. I think, and there have been proposals every legislative session for the last 5 years to allow home grows. I think the perspective from law enforcement is if you're creating a legal market, then why do you need to create an opportunity for folks to grow for themselves and possibly sell out the back door? When I consulted with the states of Colorado and Oregon, one of the things that they said if I could go back and change something, I would not have allowed for home grows. I think it was part of the compromise in the initiative, or in the case of Colorado and constitutional amendment, it was really about the ability for people to grow for themselves. The limits that they placed were they were very high. 99 plants in Colorado. In Oregon, and in fact, in the last couple of years, they reduced that to 16 plants, because what was happening was people were coming into the state from other states, cultivating, and then taking it back to their states. And so there was a large amount of diversion that was occurring in those states. And I think the issue is not so much in the state, but it's the ability for folks to come in and grow on their own and then export it out of the state. But we've heard from law enforcement their concern with respect to that. But we do allow for cooperatives and home grows for medical cannabis.
Okay, Dr. Butler, 6 plants.
Yes, Senator. The story in Alaska is really based on the history at the time when ballot measure 2, which led to legalization in 2014, passed. It was on a background of nearly 40 years of quasi-legality of marijuana for personal use and home grow in the state. This was based on a state Supreme Court case, Raven versus Alaska. The ruling in 1975 interpreted the state constitution's guarantee to privacy as including the right to be able to grow and possess small amounts of marijuana in the home. So we've had literally decades of varying degrees of decriminalization, near legalization, on which the full legalization with retail sales permission was launched in 2014. So there has not been talk of putting the genie back in the bottle when it comes to home grow.
But there is there some law enforcement of the 6 plants, or only on a complaint basis?
When I talk to again, I'm not a constable, and when I talk to my law enforcement colleagues, I don't hear a lot of discussion of this topic, although I'm usually talking about more dangerous illicit drugs when we're in conversation.
Okay. Thank you to both of you, and I'll move on to